because this disease can be transmitted to you or your children. And we've been able to find cancers in very like stage 1 cancer, breast cancer stage 1, and then
Hi guys, welcome back to my channel. On today's episode, I'm with Dr. Chinonye Okoye, and she's the Senior Medical Officer in charge of health assessment at the Benin Medical Care Hospital, Benin, and she'll be speaking with us today on something very important, which is health assessment or health checkup. Good afternoon, Dr. Chinonye.
good afternoon, Dr. Rosa.
How are you doing today?
I'm fine, thank you.
Okay, can you say hello to the viewers?
Hello viewers, hello everybody.
Okay, thank you so much. It's
Thank
nice
you.
to have you here today. Thank you for creating time for us from your busy schedule.
It's a pleasure.
So first, can you tell us about health assessment or health checkup as we know it and what it really means?
Okay, so like Dr. Rosa said, I'm the Senior Medical Officer in charge of the Health Assessment Clinic. So basically here, what we do in our clinic is health assessment. Like everybody knows, right now the world is tilting towards preventive medicine rather than curative, because we believe that prevention is better than cure. And if you can catch the disease or whatever the medical condition in its initial state, we can ensure that we are able to tackle it effectively. So basically, health assessment is a way of monitoring your health. There are a series of tests that we conduct on you to make sure that every organ, every system is in perfect function, so that we can catch a disease process in the initial stages so as to get a better outcome.
You've told us about the importance of this test and what it is. What are the different types of health assessment tests that we can get?
Okay, so here at BMC, we have a lot of health assessment packages. We have a lot of tests. The tests are basically tailored toward an individual's needs. So there's no one size fits all package.
Okay.
So it depends on what you have already. Maybe if you have like diseases like diabetes, hypertension. So what we do is we select those organs that are affected by hypertension. Like if you're hypertensive now, we know that the heart can be affected. So we're going to check your heart function. We do the ECG, we do echocardiogram, we check your heart cardiac enzymes. Then we do other tests like electrolytes, urea and creatinine, because you have hypertension, and we know that along the line the complications can arise in these different parts. So if you're diabetic also, we have those tests. We also have tests for children, especially those that are starting school. So we tend to look at, okay, is this child anemic? Is this child, what is the genotype of the child, the blood volume, all these things are necessary to ensure that a child is actually healthy to start school. Then also we have the domestic workers package. So if you want to hire a domestic staff in your house, you want to make sure that the person is coming to you without any disease processes, like viral illnesses like HIV, hepatitis B, hepatitis C, syphilis. So you need all these things to be done before you employ the person, because this disease can be transmitted to you or your children. So we offer those different packages. We also have packages for those that are basic, nothing is wrong with them, but they are sedentary workers, and we know that with sedentary work there are complications and risks. So we tailor the test towards this whatever your occupation is or whatever your health condition is at the period of time.
So let's say I want to come for a health assessment, for instance. What's the procedures I need to follow? Say I'm coming for one in this hospital. What do I need to do? How do I get started?
Okay, so the first thing you do is to register for the clinic, get a hospital number card. So they will send you up to this clinic to see me. So when you come here, I examine you, talk about your history, tell me if you're in any drugs or anything has been done for you in the past, if you had surgeries in the past. So we're trying to get like a baseline for you to understand maybe if you have any disease process already that is ongoing, or if there's any particular reason why you came for those tests. So once we are done with this history and examination, then together we'll sit down and we'll discuss on the best package for you based on your needs, and we send you for the test. There are a whole lot of tests. We have blood tests, stool tests, we also do x-rays. You can do a CT scan of whatever part of your body we feel is necessary, MRI, all that. We have all the equipment and we run all these tests extensively according to your needs. So that's the keyword, according to your needs. Then when the results are out, you come back to the clinic and explain bit by bit every test, what they mean, what we can now do to help with whatever we find.
How often should this be done?
Okay, so like most times, most people like to do their tests biannually, that's twice in a year. So every 6 months you come and repeat the test. But I would like to, for me, I like to specify into age groups. The younger age group, you can do it once yearly. But if you are like up to 50, we advise that you do it twice in a year so that you just keep track of it. But there are some specific diseases that need you, like diabetes, for instance. We encourage that you come for a 3 monthly checkup. We might not run all the tests, but there are certain markers that we use to monitor your progress. So it's important that you also do this. Your doctor will advise you on how often you should come and repeat your tests.
So lastly, before you go, is there any word of advice that you'd like to tell us today before we let you go?
Okay, so I just want to reiterate the point that many of us have several conditions and we might not know. It's very especially in Nigeria here where we live, there are a lot of disease conditions that don't initially give you signs at the beginning stage. So it's important that you actually go to the hospital and check yourself regularly, because many, like hypertension, we call it the silent killer. You might not know that your blood pressure is high and one day a person just drops dead and everybody's confused. But if you have a habit, or you have you check your health religiously, you might be able to find out these things just when they are starting and you nip it in the bud. We also do cancer screenings here. So we've been able to find cancers in very like stage 1 cancer, breast cancer stage 1, and then immediate chemotherapy and surgery. The person goes about, the person forgets that they ever were diagnosed of cancer. But you can't benefit from this if you sit at home and let the disease come upon you with its full force.
So we've heard from the doctor that it's easier to prevent the disease than it is to treat it. So do your regular health checks, go for your regular health assessment. It will benefit you greatly. Thank you so much, Dr. Chinoye, for giving us your time today. It's been a pleasure having you here. Thank you so much, and
Thank you very
do
much.
have a nice day. Okay.
It actually takes the total average of refractive error in everybody's eyes.
Okay.
You can also measure the curvature of your cornea, gives us total curvature of your cornea. Then the next one beside it is called the tonometry. It measures the intraocular pressure of every human being's eyes.
Okay.
That you can use to track those that are under glaucoma treatment if the pressure is normal or way above normal. Then the chair for testing. And they have Forota as a hanger there for lenses. We also have the normal single lenses. We have prisms, concave, convex, cylinder concave, cylinder convex. We have prisms, pinhole, Maddox rod, pinhole, occluder. This is called ophthalmoscopy. We used to check the back end of the eye to check for pathological changes. This is what we used to see if somebody has physiological coping or the person has diabetes, retinopathy, macular degeneration, any that happens behind in the fundus. You use this to look at it. This is called biometry. It's called B-scan. It can take both pachymetry test and also measure the IOL inside somebody's eyes. This is what we use for that. If you want to do surgery, you have to know what to use to replace the one you are removing. You use this. This for checking what somebody has in their prescription. It's called lensometer. You use it to check to know what the power currently the person is using. Or if you do a glasses for somebody, you use it to also confirm that what you give the person is correct. This is called the central vision analyzer. It's computer. It has one computer that governs it, though it's not on. It's called the computer visual field. It checks the visual field of each patient to know whether you have problem at your macular area, why the person is not having peripheral vision. This is how the computer comes up. When you want to use it, you use it. Person presses, occlude one eye at a time. Person press to tell us how many points of light they see inside there. And the machine does it automatically. So this is fundus camera. It has inbuilt camera into it. The patient sits there, he sits here to make the examination. It snaps the fundus and brings it out for us to be able to check if there are pathological changes. We use this to track those that have known pathological diseases. For example, person has glaucoma, for example, or has early signs of diabetes. We use it to track how many spots of cortical spots you're seeing, how many exudates, use it to track it. It's not first one, second one, but to be able to use it to track the changes that is happening in the person's fundus. We also have another one called street lamp. This is multi-purpose. In the sense that you can still use it to check IOP. What the other machine does, you can see easy to do it by attaching a Goldman applanation here. You can use it to check it, but this you use it to check the anterior segment of the eyes. If the person has maybe blood in the anterior chamber, you use this to be able to know. You also use this to check position of cataract, how the cataract is positioned, whether posterior or anteriorly. You also use it to check for detachments. It has different lights, filters in them that you can use, blue, green. You can turn from here. It also has magnifying lenses, and you can reduce the beam of the light. It's multifunctional, like I said.
Thank you very much, ma'am.
You're welcome.